Good morning, and thank you also for having me here. It's an honor. I was here last in 2009, and I wanted to give a little bit of a snapshot and a history of kind of where we were then and where we are now from the standpoint of digital health technology, which is what Health 2.0 sort of represents and brings together. So back in 2009, Health 2.0 was a small conference. It was kind of a new kid on the block, if you will, in terms of conferences. And we were focused on an emerging sector that wasn't even officially called digital health yet. In 2018, we've now sort of been housed with, joined forces with HIMSS, which is one of the leading health IT associations and industry standard conferences. So that's been one big change. In 2009, at Health 2.0, which was just a few months within Transform of that year, a telemedicine company, American Well, was launching for the first time. This was one of the first web-enabled telemedicine companies. Just this quarter, this company went on to raise over $360 million. And telemedicine, while not necessarily the perfect answer to everything, and not fully executed along, in terms of the vision for it, is now, when you interview employers of the National Business Group on Health surveyed employers, 96% of employers say they plan to offer telehealth services in the coming year. In 2009, this is Ronnie Zeiger from Google Health. They were speaking at Health 2.0 and exploring the first sort of web-enabled PHR. While that wasn't exactly a success, in 2018, Google has made a big dent in healthcare now with Google Home, voice artificial intelligence, and of course to become a big kind of player in the cloud for medical records. 2009, if anyone remembers Navigenics, one of the first direct-to-consumer genetic companies, had launched, but the California health regulators had said, you know what, you can't do that unless a physician orders that kind of genome sequencing for the patient. 2018, this was just 10 days ago at Health 2.0's fall conference, the winner of our launch competition was a blockchain-based biomedical data management platform, of all things, where the patient/consumer is completely in charge of their genome and can contribute it to various initiatives of their own accord. So a lot's happened, if you will, in the last 9 years since I was last here. And I just wanted to pause a little bit on where we are today and dig further. So let's look a little bit at this ecosystem that we think of as digital health. So at Health 2.0, we're following about 4,300, 4,400 companies globally in the sector, over 6,000 products, and we categorize them in 19 categories. From consumer-facing technologies to patient-provider communication, professional-facing technologies, and data analytics and exchange. And interestingly, some of the biggest growth that we've seen has been on that B2B side of this digital health ecosystem. Decision support and analytics, patient-provider communication. And what about the funding? This is something we'll go into a little bit because there certainly has been a lot of it. In the last 7 years, we've seen exponential growth. Last year was double the year before that. And this year, we're about on pace of last year, a little bit ahead, if you will. And depending on who you read, between $3.4 billion and $6.1 billion just through the second half of this year has gone into this digital health ecosystem. So the question we might ask is this a bubble? Is the industry really going to support this level of investment and rapid growth? And what are we really doing in terms of seeing the benefits and the value of all of this investment? Well, let's look at where that investment has gone, and maybe we can sort of think through these patterns together. So these are big numbers. This is investment this year compared to total investment overall, the 10 biggest deals in digital health. But they break into some interesting categories. You've got telemedicine and virtual care services like Livongo, diabetes management and integration. You've got a cluster around payment and payment ways that we're improving sort of health insurance from Collective Health and Oscar. You've got a cluster around diagnostics and sort of the new generation of diagnostics around genomics and life sciences. And you have new models of care delivery entirely, Iora Health and One Medical, looking specifically at how you can do better primary care. Let's look at some of the biggest acquisitions in this space to give us a sense of where things are going. This was one of the biggest in February of this year. Flatiron, which is a cancer analytics company, was purchased by Roche for $1.9 billion. And Amazon bought a company that actually presented at Health 2.0 in its younger days. They bought PillPack in June of this year. Huge deals. And it's telling us that some of the entrants into the space are not your usual suspects, of course. And it's also giving us a sense of the pattern of investing in those 4 areas I mentioned earlier. So, is it a bubble or is it not? Are we going to see growth in this sector, and are we going to see the results that we're looking for from these new technologies? Well, it depends on whether you believe in a couple of assumptions behind this investment in this sector. And one is that, do you still believe that value has promise and that we're going to move continually toward a value-based world? We still have a lot of room to go there. This is a survey by the AMGA showing that fee-for-service still dominates payment. Many of these technologies coming out of the digital health ecosystem are betting on the fact that we're going to move toward a value-based system. And if you believe that, there's room to grow there. The second, if you will, set of factors, I think, comes from this idea of the stick. Maybe value-based payments, alternate payment models are there as more of the carrot. There's sticks coming, and that is forces looking at what are seen as margins in healthcare that are unsustainable, whether that's coming from a policy perspective or from new entrants that really understand and own that consumer experience in so many other sectors of our lives. Okay, so that's sort of where we are in digital health today from a funding perspective, from a general technology distribution perspective. But what's really going on here? And I think what we're seeing is that there are points of failure, none of which the Mayo Clinic are doing, other institutions. But care delivery organizations are looking at sort of 3 big points of failure that are in turn becoming battlegrounds, if you will, for competition from a new and emerging sector that's no longer the sort of small fringe companies that were at Health 2.0 in 2009 and perhaps presented here 10 years ago, but they're extremely well-financed that are now repeat entrepreneurs who are building those partnerships and driving that enterprise integration. So points of failure becoming battlegrounds. So what are they? I think the first is, and we all, I think, understand many of these, I'm just going to give some examples, is that we don't know enough as the healthcare system. And so we have a lot of room to grow in the world of data analytics and real-world evidence, and companies are aggressively pursuing that, whether it's Aetion and Evidation looking at what interventions work for real evidence-based analysis, to Prognos and Lumiata looking at which patients are going to get sick before they actually get sick. So from an intervention level and a patient level, insights and data analytics operating at very high levels. We don't do complex chronic care well. And by this, let's break this down into what we mean exactly by this. So there are certain conditions in which there are highly specialized needs that patients have. And I think in those small groups, you're seeing new companies come in and go after those niches to manage them with really high touch care, a lot of analytics, and are actually having better outcomes than groups that are taking on all patients and doing that, trying to do that evenly across the board. There's high levels of physician dissatisfaction. We're not looking at the overall patient experience. And I think there are companies now coming on to address that. And so let's look at some of these specialized care delivery models and how they're being financed. So Parsley Health, just an example of a care delivery model around functional medicine, holistic care, with a strong focus on the member experience. Village MD and Devoted Health, each taking either whether it's Medicaid or Medicare patients and focusing on very, very high needs patients using a data-driven model, as well as a lot of workflow support and workforce support. Aledade, allowing independent primary physician groups to come together as risk-bearing organizations so they can function like mini ACOs, addressing some of that issue of physician autonomy and physician dissatisfaction. So a generation of companies coming up around these specialized care delivery models to address the point of failure, if you will, that we don't do complex chronic care well. We don't do enough of extending care beyond our walls. And we are now having companies working on the battleground, if you will, of meeting patients where they are. So whether that's having the pills that if you're a chronic patient with chronic disease and you have medication from for a number of different purposes, having those all sorted for you and delivered to you by pill pack. Doctor on Demand, yet another telemedicine company that's having high penetration. Livongo taking that experience from diabetic strips to the device to coaching to monitoring and integrating it into one experience with a coach. Heal, which is bringing the traditional doctor house visits, if you will, in a very modern way. I'll get into them in a minute. So these three battlegrounds, I think, represent some areas where existing healthcare institutions can do a lot to either partner, transform, and think through how they're delivering care. But technology, where does that fit in? It's not just an enabling mechanism for competition, if you will, in this new ecosystem. We believe it's fundamentally driving a change. So care delivery organizations typically began with the delivery of care and added services and technology to support that. That's how we did it in the past. What we're seeing today is sort of an inversion of that model being driven by technology. And the digital health ecosystem introduced, I think, 5 layers that I will go into. So technology typically was data storage in the EMR. Today, we're looking at cloud-based solutions that are offering us intelligence and are allowing the extension of passive storage into situations like blockchain and others, where we can go further with just data storage. The transaction layer, which had to do primarily with clinical orders and billing, that's now being enabled by a whole generation of technologies improving workflow and operational efficiency. Companies like Cedar, who are making an intelligent billing system across the spectrum of care, simply allowing patients to have all their bills in one place. And Carbon, allowing for chats with physicians across the spectrum of care to integrate labs, pharmaceutical data, and others so that transaction element stays consistent through the care experience. Data exchange, which used to be sort of interoperability 1.0, is now being driven by FHIR protocols, using the EMR like an internet browser. And new FHIR-based architectures are the backbone of companies like Medisafe, which are looking at medication adherence, and Redux, which are data integration engines that are now allowing developers and health systems to use FHIR if they work with them. The fourth layer that the digital health ecosystem has sort of brought into the tech stack, if you will, is data analytics. We simply didn't know what was in our repositories before, and now we have a whole slew of companies. This is one out of Spain that's looking at natural language processing of physician notes, something that we don't often think about as being part of the EMR and computable in the same way as other fields. And CODA, which is looking at the real-world evidence that we need to bring to bear on the lives of cancer patients, because it's not just about the clinical record or what's in the claims database. But perhaps most importantly is the interface layer. And here, whether we're talking about the consumer or patient environments or the physician and provider environments, companies that are bringing new ways of looking at information. This is a consumer-facing technology using augmented reality that can tell you whether a particular food item matches your dietary restrictions or not. And of course, we have in the clinical environment a whole class of companies working with voice artificial intelligence that are activating apps through that interface across multiple different modalities. So what's happening now, before we had care delivery as the sort of foundation of the stack with services and technology above to support it, we believe this is becoming an inversion, if you will, with those technologies that I described in those 5 layers forming a technology platform upon which services and care delivery can be attached, and that this new stack is a formidable entrant into the digital health ecosystem today, and perhaps a model for how we even think of transforming as incumbent organizations. So let me give you an example of what some of these full stack organizations might look like. So Heal began in 2015 as just bringing doctors' home visits back. They said it made sense when doctors came to your home, let's do that with technology. They went from about 500 home visits in 2015. They're now doing 70,000 and are covered by most major health plans. A doctor comes to your home, but there's also a device in the home that can transmit diagnostic data back to the EHR through this new Qualcomm partnership called Wellbe. Medically Home has been reviewed for a few years now with their clinical studies, bringing the hospital to the home with a number of devices and protocols and team-based care so that for certain conditions, the outcomes are the same, that you can be treated at home for heart failure. And Virta, which is a diabetes management program, is also one of these, if you will, full stack organizations that began as a technology platform. They've added care protocols for managing type 2 diabetes and in-home visits as well as virtual care. They're now claiming, and you can go read the data for yourself, that 94% of patients within 1 year who have type 2 diabetes either get off of insulin or reduce their insulin requirements. And so these full stack companies are actually driving meaningful clinical results. So 3 consequences of the new stack. I think if we think about data technology in these layers, we're not just talking about one-off solutions, but taken as a whole, we can do powerful things if we come together and think about that integration, as was said earlier by Dr. Wood, to innovate at the point of integration. So we can offer customized and flexible care experiences across infinite and continuous care environments. And this also gives us a really wonderful entry, a doorway, if you will, to address the social determinants of health. But ultimately, we have to ask, again, I agree, it's not about the shiny gizmo or the cool new app or the virtual reality headset. The fundamental question we're asking here with this ecosystem of technologies is, can we align the business of healthcare with the business of health? And a few ways we can think of doing this. This is just examples. This is a partnership between Walmart and a brand new cognitive neuroscience behaviorally designed app around healthy habits. And they're rolling this out. They launched last week, and they're rolling it out to 2,700 stores. All of the associates, the millions of associates who work for Walmart, will have access to this. Walmart did this internally. They worked to create this product themselves. So we can build our own. We can partner. Lyft is now partnering with 9 of the top 10 health systems to bring patients to their appointments. 3.6 million appointments are missed every year with dramatic health consequences. They've now integrated with EHR companies and are making a pretty impressive imprint here just with sort of transportation. And we can think of other ways of partnering with purely consumer-driven companies in health. This is Aptiv, also new, just raised money from Disney and Amazon, $55 million in 22 months for audio-led workouts for folks. But they're going to be getting into specialized programs for people with different conditions. So think of, just because it's a consumer-facing health app, it could have relevance as a potential partner. And Helix, I've been talking a lot about genomics. This company, I just couldn't believe it. I saw an ad on television for them. And I thought, boy, we're really back to direct-to-consumer again, aren't we? And this is a genome sequencing company that's treating your genome like an API, where you can have multiple applications off of it. Again, that market that's going direct-to-consumer, can we think of more of convergence as opposed to diverging as we move forward? And I think Jerry Greene earlier and I were talking about how do we create an ecosystem approach to health. I'll just conclude with one of the major challenges we all think about, I'm sure, in healthcare and whatever sector we work in. And in just thinking about the opioid crisis from a technology standpoint, it strikes me that as the more multifactorial a problem is, the sort of more multifactorial the solution set needs to be. And it was striking to us that as we looked at the tech landscape and who was doing what around this crisis, we said, well, there's issues around care coordination. There's issues around patient education, therapeutic alternatives, social determinants of health, and patient identification and monitoring. And technology is helping at all of these different intersections around the opioid crisis, but we do have to bring it together. And it does take government. This is HHS's office of the CTO of HHS put out a report just this month on the state of data sharing. And they said that there are certain laws that are still prohibiting the exchange of information at a personal level around mental health. They're working to address that. And they had a codeathon where they invited developers to come and use some of their data sets to create new solutions around the opioid crisis. We need research organizations. This is Esri doing incredible work around the geographical visualization and determinants of health. They presented at Health 2.0 around the opioid crisis, mapping not just the data, but actual narratives and stories of people that were lost to the epidemic so you could understand who the faces of this illness were. And of course, the private sector tech companies that are very familiar to us at Health 2.0, this was a facial recognition software that could diagnose somebody for risk of addiction in 5 minutes with 8 questions. And how amazing would it be to not prescribe that drug for somebody who might actually be at much higher risk of addiction. So anyway, there's a lot of talk in the world that I come from where who's going to win this new war, this ecosystem? Is it going to be hospitals and physician groups, the pharmacists, big tech companies? The most important question I hope you'll join me in answering is that it's the patient and consumer who needs to win. So thank you so much for having me.